Have you ever wondered how well your body is oxygenated? Low oxygen levels in the blood, known as hypoxemia, can creep in without warning and wreak havoc on your health.
According to a 2022 study published in the Journal of Clinical Medicine, nearly 20% of adults with chronic illnesses in the U.S. experience hypoxemia, often without realizing it.
This condition can lead to fatigue, confusion, and even life-threatening complications. Today, we're uncovering the 15 signs you may have low oxygen levels in your blood. Recognizing these early can be the difference between recovery and severe health consequences. Are you ready? Number 15, shortness of breath. Struggling to catch your breath after minor activity is one of the most common signs of hypoxemia. A 2019 study revealed that 70% of patients with low oxygen levels reported unexplained breathlessness even while resting. This happens because your body demands more oxygen than it's receiving, putting your respiratory system into overdrive. Over time, this can lead to decreased lung capacity and make even simple tasks, like climbing stairs, feel impossible.
Shortness of breath is particularly concerning for individuals with chronic obstructive pulmonary disease, COPD, a condition that already compromises lung function, making oxygen levels harder to maintain.
Number 14, persistent fatigue. Feeling drained even after a full night's sleep? Low oxygen levels can rob your cells of the energy they need to function. A research in 2020 highlighted that chronic fatigue is a leading symptom of long-term hypoxemia. This isn't just tiredness, it's an all-encompassing exhaustion that doesn't go away. Patients often describe this fatigue as feeling weighed down, as if completing simple tasks requires monumental effort. This ongoing exhaustion can lead to reduced productivity and, over time, feelings of hopelessness or depression. Number 13, rapid heartbeat. When oxygen is scarce, your heart works overtime to pump what little there is to vital organs.
A 2018 study in Circulation noted that tachycardia, or a rapid heart rate, is a common response to low oxygen levels. This symptom can feel like your heart is racing even when you're sitting still.
Over time, this strain on the heart can lead to further complications, including heart palpitations or irregular rhythms. It's your body's way of compensating, but the effort can leave you feeling drained. Number 12, dizziness or lightheadedness. Feeling like the room is spinning could be your brain's way of signaling that it's not getting enough oxygen. According to a 2017 study, low blood oxygen levels were linked to frequent episodes of dizziness in 40% of participants. This increases your risk of falls and other accidents, particularly in older adults who may already struggle with balance. Episodes of dizziness may also occur suddenly, leaving you disoriented and unable to focus. Number 11, cyanosis. A blue or grayish tint to your skin, lips, or fingernails is a classic warning sign of low oxygen.
This occurs because oxygen-depleted blood takes on a darker hue. A 2021 report in Respiratory Research found that cyanosis is often one of the first visible signs in patients with severe hypoxemia.
It's most noticeable in areas where the skin is thinnest, such as around the mouth and under the fingernails. Number 10, headaches. Waking up with a headache or experiencing persistent discomfort in your head might be more than just stress. A lack of oxygen in the blood can lead to the dilation of blood vessels in the brain, causing headaches. A 2020 study connected hypoxemia with chronic headache disorders in patients with respiratory conditions. These headaches often worsen in the morning due to prolonged oxygen deprivation during sleep. For many, they become a recurring issue that significantly impacts daily functioning. Number 9, confusion or memory problems. Struggling to focus or recall simple things? Your brain needs oxygen to function, and when it doesn't get enough, cognitive abilities can suffer.
A 2019 study in Frontiers in Aging Neuroscience highlighted that even mild hypoxemia can impair memory and decision-making skills.
This mental fog can be frustrating and may escalate to severe disorientation if the condition persists. People often report having trouble concentrating on routine tasks, which can disrupt work or social activities. Number 8, chest pain. A lack of oxygen can cause your heart to strain, leading to discomfort or sharp pains in your chest. According to a 2021 study in cardiovascular research, chest pain is a critical warning sign, indicating your cardiovascular system is struggling to manage low oxygen levels. This pain is often described as a tight squeezing sensation that can radiate to the shoulders or jaw, mimicking symptoms of a heart attack. When this occurs alongside other signs of hypoxemia, it's a clear signal that medical attention is needed immediately. Number 7, restlessness or anxiety.
Feeling inexplicably uneasy or jittery? Low oxygen levels can trigger your body's stress response, leading to persistent restlessness or heightened anxiety.
A 2018 study found a strong connection between hypoxemia and elevated anxiety levels in those with respiratory disorders. This symptom often feels overwhelming, with individuals describing a sense of impending doom or hyper-alertness. In severe cases, it can mimic a panic attack, making it hard to distinguish from mental health issues. Number 6, high blood pressure. Hypoxemia forces your cardiovascular system to work harder, leading to elevated blood pressure over time. A research in 2019 revealed that patients with low oxygen levels were significantly more likely to develop hypertension. This added strain on your heart and blood vessels doesn't just raise your blood pressure temporarily, it can create lasting damage, increasing the risk of life-altering complications such as heart failure, kidney disease, or stroke. Addressing this issue early can prevent long-term harm to your cardiovascular system. Number 5, vision problems. Experiencing blurred vision or double vision might seem unrelated to oxygen levels, but they're closely linked.
A 2020 study in ophthalmology science explained that insufficient oxygen can impair the optic nerve, leading to short-term disturbances in vision or even permanent damage in severe cases.
These issues may intensify during physical exertion or when standing up too quickly, as your body struggles to deliver enough oxygen to the eyes. Number 4, weakness or muscle cramps. Oxygen fuels your muscles, so when levels drop, your muscles struggle to function properly. A 2021 study in muscle and nerve found that hypoxemia contributes to frequent muscle cramps, weakness, and even chronic muscle fatigue, particularly in the arms and legs. These symptoms can severely limit physical activity, leaving individuals feeling incapable of performing simple tasks like lifting objects or walking short distances. Over time, this muscle weakness can lead to a sedentary lifestyle, further complicating health issues. Number 3, increased susceptibility to infections. Oxygen plays a critical role in supporting your immune system.
A 2019 study in clinical infectious diseases demonstrated that individuals with low oxygen levels were significantly more prone to respiratory infections, such as pneumonia or bronchitis.
This occurs because oxygen-deprived immune cells are less efficient at identifying and destroying pathogens. People with chronic conditions like COPD are at an even greater risk of infections, as their already compromised lung function struggles to fend off harmful bacteria and viruses. Chronic hypoxemia can also weaken your overall immune defenses, making even minor illnesses more difficult to recover from and leaving you vulnerable to recurring infections. Number 2, sleep disturbances. Struggling to fall asleep or waking up gasping for air could point directly to low oxygen levels. Hypoxemia often accompanies sleep apnea, which disrupt normal breathing patterns and prevent restorative sleep. A 2020 study in sleep medicine confirmed that insufficient oxygen during rest doesn't just lead to daytime fatigue. It can also trigger other issues like morning headaches, irritability, and difficulty concentrating. Number 1, cold hands and feet. Poor circulation caused by low oxygen levels can leave your extremities feeling icy, even in warm conditions.
A 2018 report highlighted this symptom as a common sign of oxygen-deprived blood flow to peripheral tissues. Over time, reduced oxygen can cause persistent tingling, numbness, or even pain in the hands and feet.
These symptoms often indicate that your body's blood delivery system is under strain, signaling a more serious underlying issue that needs attention. These warning signs are your body's way of telling you something isn't right. If you've noticed any of these symptoms, don't wait. Consult your healthcare provider immediately. Early detection and intervention can make all the difference.
And there you have it. What are your thoughts? Next, dive into this video for more essential tips to transform your health and help you thrive. You're going to love it. Thanks for watching Healthy End, and we'll see you there.